Hello. During the survey of CBAHI and JCIA, the surveyor will give you questions. In my lecture, I collected all the subjects that he can ask you. This is a lecture which he really made to tell you all what you should know. If you really know all what you should know, you will be confident, but try to make use and know it by heart. You will be confident and you will answer with confidence without fear. Now, all what you should know during the survey will never go out of these 4 subjects: safety, patient rights, staff qualification and education, and equality. These all what you should know. If you know all this, I am telling you, I give promotion. If somebody who have a question by CBAHI outside of this subject, I will pay for him 5,000 riyal from Baka. This promotion is during the month of April. If you give me a question outside of this subject, I will pay you 5,000 riyal during April. After my lecture, I will give some question with money to help you to concentrate and learn by heart. At the end of this lecture, you will be able to answer by heart. Bismillah ar-Rahman ar-Rahim. We'll start by safety. Safety represented by S, and safety is about 50% of your subject. I am telling you that a surveyor will never ask, if you are not asking about safety, it is not a survey. Safety is represented by S, has 2 ends. One for infection control, which is a half of safety, and the second is environment of care. So safety has 2 big subjects: infection control and environment of safety. Infection control has 5 big subjects, and environment has also 5 big subjects. Infection control, which is the first subject of safety, you will have to know the 3 things, that is the rule of 3. Definition. You rule, and you will be asking what are the resources that you have taken from information. You will tell him plan, my plan, and policy and procedure. Plan and policy and procedure. In all questions. Your resources, plan and procedure. The definition is the same. The 5 subjects are here. We have abbreviation which is called HYs. What's the definition of infection control? It is to prevent infection transmission. I will take the first subject, which is H, hand hygiene. The rule of the subject, the rule of the staff, we will follow all of 3. The first thing, when I wash, before and after. Don't break your head. Before and after everything. Before entering the room of the patient, after entering the room of the patient, before procedures, after procedures, before eating, after eating, before and after everything. The second, by what? By 5 cc of soup or 5 cc of alcohol for scrubbing. And the third is how I wash my hand for about 1 minute. 45 seconds or up to 60 seconds, where I wash the ventral, the dorsal, the between fingers, the thumb, the wrist. So this is H. Number 2 is the W, which represents waste disposal. Waste disposal means, and the definition is to prevent infection transmission by wastes. So we have to make disposal for wastes. From where your resources? We have a plan and policy and procedure. What is the rule of the staff? He will ask you about your rule. You will tell him, for general waste, I put it in white bag. For medical waste, I put it in yellow or orange bag. for highly infected in a bag, in a red bag. What about sharp objects? Sharp objects, I should never recap it. I threw it in the sharp box, and I will close the sharp box after it is 3/4 filled and or 2 weeks after opening. It is very easy. The next subject is I. I means isolation. Isolation of infected patient which can cause infection. So to prevent infection transmission by infected patients. So I isolate, we isolate, make isolation for this infection patient. Infected patient can make transmission by contact, by droplets, by airborne. Contact, it means that the disease can be transmitted by contact, or by droplet, or by airborne. What is the rule of the staff? We have to put the PPE, personal protective equipment, which is a gown, mask, gloves. Gloves is very important for the contact. Droplet infection is a mask. Droplet infection for pneumonia, for example, it is a mask. But airborne, you know that the microbe is very light and will be in the air of the room. It means that the transmission like smoke. So we have to put a negative pressure inside this room of isolation, and we will use the mask of N95. Before entering the room, you know that your patient, you will find a signal on the room which is blue. Blue means that the inside is isolated contact transmission, isolated patient for contact transmission. Or if you find it green, so you should know that infection can be transmitted by droplets. So you take care of your mask. The patient should have a mask. If it's an orange, it can be by airborne, negative pressure, and mask of N95. The fifth subject is sharp injury, represented by S. Don't forget H-Y, so finish H, W, I. Now I am S. S means sharp injury. Sharp injury, if I have injected, if you are bitten by a needle which is used, you have to wash your hand, you seek for medical treatment. You will go to the infection control nurse or in the ER, and you have to write an OVR. 3 things, probably. For the fifth, the last is the E, environmental spill, blood, pus in the earth. What shall you do? You put precautions to prevent anybody to walk over, to call the housekeeping, and after cleaning, you disinfect the area, or she will disinfect the area. Equipment also is BIE. Equipment, you disinfect your equipment with what? With alcohol or biotic. You cover your instrument by cling film, and after use, you will re-disinfect your equipment. So now, in this slide, you cover everything about infection control. The second half of safety is the environment of care. And here we have abbreviation H size. You remember infection control all H wise. Now it is H size. Very similar, easy. You will have also definition. You will be asked about the definition. You will be asked about the role of your staff and your resources coming from plan, policy and procedure. From where you are educated, from education, from orientation, CME and the drill. Now we'll start by H. H for hazardous material. Hazardous material are the materials you are using every day in your work. But this material may be hazardous and cause harm for you. So what shall you do? You should read about this. As if any medicine you buy, you open the medicine, the box, you find a pamphlet. In this pamphlet, everything is clear about the composition of the material you are taking, or the medicine, the action, the precaution, the dosage, and so on. So also for our hazardous material, we have MSDS, which is a pamphlet which have all the information about your material you are using, And in case of accident, what shall you do? If it comes over your eyes, what is the effect of this? And also, you will have for each the signal of the material you are using, carcinogenic or burning material, corrosive, poisonous, radiating, fire, can cause fire, alcohol. You are washing, you are cleaning your hand by alcohol, so it is flammable by gases or oxidizer. These are symbol present on the box of your material, but also there is a label design. So you have three now. You know, the first is the MSDS, the second is the symbol and the label design, the third is writing. What does it mean, label design? We have materials which can cause fire, which can cause activity, which can cause health hazards, and which can cause different types of hazards. If it is fire, your material will have this signal and rated from 0 to 4. 4 is very flammable. 0 is not flammable at all. And health hazards can be killed if it is very highly hazardous, it will be 4, and so on. So you have to know also that in your material you have to know what about label design. It will not ask you in details, but at least you know the principle of this label design. Label design means the effect, the hazardous effects of your material. It can be flammable and health hazards. It can be reactive, it makes reaction on your skin, and also health hazard, and so on. So the second point is the C, which is the C of H size, the C for emergency codes. Emergency codes, all of us know that there are emergencies. Most of them, the most important is a fire, external disaster, internal disaster. But we are using code in place. Why? Well, first we have to understand why we are using codes. Why we don't say fire? Because if there is announcement of fire, he will say fire in zone number 1 or X-ray room. Everybody will be panicked. So the best way is to announce red code in area number 4. So there will be panic. You understand and you will know your role. First, we should know the definition, as we said before. Staff role, you have to remember that if you call by alarm, you raise 4444. And what are your resources, plan and policy and procedure? You look that we have the plan of these safety or safety people, FMS, and education. Where you have educated this, orientation, semi, and drill. We have done drill. This is going to start in all codes. So, what are the codes? What are these emergency codes? What are these emergencies? If I ask you, you will tell me, yes, there is code red, yellow. I will tell you an easy way. You remember the color when you were in school? The red plus white gives pink. The blue plus yellow gives green. The red plus blue gives violet. So when we have, so you know, red plus white gives a pink, blue plus yellow gives a green, red plus blue gives a violet. So what is the red? Red code, it means that it is fire. What is the rule of the staff for fire? So first, raise, pass, and I know my plan of evacuation. So rule of 3. Again, rule of 3. The second, what is the white code means? White code means that the possible bomb threat. You should search or you look for suspicious thing. You should recognize the person who is pronouncing that, or you have to call the security. What is the color? What is the code pink means? Code pink means that there is a child abduction or a child loss. So we close the door. You have to close the door. Your role is in 3. Close the door, search for the child, call the security. What is your rule in case of code blue? What is code blue? Code blue means a medical emergency. Definition, medical emergency. What is your rule? My rule is doing BLS. I have done BLS. I am surveyor. And you should know where is the crash cart in your area. And we have a team of BLS team. What is yellow code mean? Yellow code means internal disaster. There is specific action. What is the green code means? Green code means external disaster. So you have to prepare your equipment. You call enough staff, and you stand by waiting for the action to do. Either it is coming, for example, accident, airplane accident, and you have thousands of people, you have to save them. Okay? Violent, mean that violence. It will be announced that there is violent code, or you are the one who is violated. By whom? By somebody. So you have to make a distance. You should not make a distance between you and the person. Should not keep yourself behind in the wall behind you, and you should call the security. Hazmat material, can forget about it, it's toxic gas. The next is international patient safety laws. So we have hazardous material, codes, now the I, which is international patient safety laws. International patient safety laws are very important. Sometimes they put it in safety, sometimes they put it in quality, but you have to know by any way. You will be asked sure about international patient safety laws. So you should know what are these. There are 6. Perhaps difficult to know. I will tell you a very easy way to keep in your mind. You remember my story. We have a picture of a man. You remember this? A known man, unlucky man, on a broken bed, and there has been surgery in the wrong side. The second is Sister Careless, which Advaya gives a medication. We have infection by microbes and communication. This picture, 1, 2, 3, 4, I want you to keep these in your mind, please. Close your eyes and you see the 4. A man in bed with a broken leg, a sister with searing, microbes, and the last one is telephone for communication. So the parent picture has 3 of the international patient safety laws. The first one, in rule, it is correct identification of the patient. Rule of 3, I should identify the patient in a name of 3, identify by ID number or by wristband. 2 identifiers are enough. The second for this man is to prevent risk of fall, because he has a fall. So, rule of 3, these cause of fall are the patient, maybe conscious, unconscious, vegetated, whatever. I hate fall. The second is agility, the bed is broken, or the staff. Enough staff, the staff left him and he did not be helped, so he has a fall. So to prevent risk of fall, we have to make sure to have to look at these 3 things. To prevent wrong side, because it has to be looked in the right side, wrong side, wrong procedure, and wrong surgery. From this big picture, we have 3 of the international patient safety laws: identification, prevention of risk of fall, prevent wrong side, wrong procedure, wrong surgery. From this picture, I remember the medication, wrong medication, how to prevent error of medication. Rule of 3. First, the medicine should be labeled. Sure, should be labeled, very important. Similar containers should have different colors. And high alert medication should be in a cabinet. Rule of 3. What about prevention of infection? Rule of 3. We have, remember, H, Y's, or you can say Y. The W is waste disposal, the H is hand hygiene, and I is isolation. Communication. We have to make effective communication. In 3, WRC, read, write, read, and confirm. Some people can speak about SPA. Now, the fourth subject of our environment of care is the security. The question is your area in security or not? Yes. My answer is yes. First, everybody carries his ID number, so we can recognize the staff from outside people. If somebody puts the gown of a doctor and he has no identification card, so he be suspicious. Second is we have security staff. So we have cameras everywhere. So all these are methods for security. The fifth, the last one is the E, equipment. Is your equipment is safe? Yes. How? Because in 3, rule of 3. First, an installation. The engineer which has installed it has given me certificates that this machine has been well calibrated and well tested. After use, we have periodic preventive maintenance every 6 months or 1 year. And in case of shutdown, number 3, in case of shutdown, we have an action, and every machine has its own file. After finishing safety, we will continue speaking about these are the, I forget the infection control method. We forget about the patient rights. That is the third part. Patient rights, you remember also fixed letters I, C, C, and P, C, C. How can you remember this? I, C, C, and B, C, C. I, C, C, and B, C, C. But you will remember also the patient rights in the story. When the patient comes to you, you will give him information. The doctor will give him information. That is his right. In rule of 3 again, this information concerns his disease in details, the treatment that you will do, and the cost. You have the right to know all these 3. Number I, the first I is information. And the rule in 3, rule of 3, disease, treatment, and cost. The second is C, which is what? After you have told the patient in details about these things, you will ask him for consenting. Does he accept or not? Of course, you will sign that you have given him in details, and the patient should sign that he accepts, and the nurse should, as a witness, will sign. So you have 3 signatures. Rule of 3 again. The third is care. Third C is care. Care of everything. You take care of your patient. Whatever. Care of everything. There is no definition of what will be the care. Care of everything. What is P? P is the privacy. In 3, patient has privacy for his room, for his body, for his belonging. For his room, I cannot enter without knocking, without his permission. For his body, I cannot touch him or examine him without permission. And for his belongings, the patient has his belongings and don't touch without his permission. This is privacy. The next is C. And we have I, C, C, P, C, C. What is C? The fifth is the confidentiality, which is very important item of rights of patient. The confidentiality of the information about his disease is the information on the file. Nobody has the right to look at the file if he's not concerned, even doctors. Computer after usage should be shut down. And tongue. People are speaking.
this man has AIDS because he has a relation, don't tell his wife. Don't tell anybody about that. And the other, this man has a tract infection because of course. This is confidential, you should not speak. Confidential. The last one is complaints. After doing all this, the patient has a complaints against the poor person. These are the rights of the patient. After that, the staff should have qualification and education. You should know this by heart. And why? Because it will save you to know some questions about your education, but also in quality. So to remember all the story of the staff education and qualification, you remember your story from the start of recruitment. From the start of recruitment, you have 3 C. You have presented CV, your CV, certificates of study and certificates of your experience. After that, you have admitted for working so you have to get a license or MOH and health specialty, Saudi health specialty. You have been passed an exam and the credentiality of your certificates. The third, orientation. This is a very important part of all this. Orientation. The surveyor wants to know if you have been well oriented or not. Yes, I am well oriented. From the start, I have general information in the nursing office of orientation. I have here a very important paper. You can have it in details what you have to know, general orientation, departmental orientation, and specific job orientation. Full of items. I hope that everybody should have a look at this. You know all of this, but you should keep it in your mind. So we have general orientation, mission, vision, hospital, country, your money, your salary, your bank, your ID number, and also what we said before about safety, about infection control, about environmental safety, about rights of patient. All these are general. Specific about your job description and your policy in the department. And after that, you will have job specific orientation in your area. After that, you will have your job. Of course, you receive your job description in details. You will be trained before starting working. And you have privileging, and there is privileging for doctors. Not all the staff. The last 5, the number 5 for orient, what is education? You will be asking, have you been educated since you are here? Yes, I am educated. We have orientation, we have CME, we have drills, we have symposium, we have conference, and evaluation. Are you evaluated after all this? Yes. We have evaluation 3 months after recruitment and annually 1 year every year. But for doctors, there is focus 6 months and annual evaluation. The last very important subject is the quality. Quality, nobody understands the quality well, but you have to keep in your mind several important points. What is the definition of quality? He will ask you, what is the definition of quality? You will tell him the same answer every time. It is to do the right things first time and every time. The second, equality is the responsibility of everybody, like safety is the responsibility of everybody. From where we have PI department, QPS committee, and all other committees. These are for quality. Where you have got, or your information, or what you are following, are following the PI plan, performance improvement plan, and policies and the procedure. Now, what is quality? How can we practice quality? Quality have a system. Quality is based on a system. This system is called performance improvement system. Performance improvement. You have to know this performance improvement system. What is this system? This system in this quality, like this, remember safety? We have 2 points. In this Q, we have 3 points, which represents this performance improvement system. 1 point is called awareness. The second is measurement. The third is improvement. These are phases of quality. Practically, when we practice quality, we are practicing this system. So we have to know what is awareness and measurement and improvement. This is the work of quality people, PI department, but we have to know to apply quality. Awareness is the first phase of this system. Awareness of what? All we have said before, awareness of everything that was said before, orientation, safety, infection control, job descriptions, indications, everything. The more you are aware of these things, the better your quality is. You will practice quality. So the importance of this awareness is to leading to quality. The staff who knows information, orientation, safety, infection, he will do good work, good quality. He will do things right every time, first time and every time. What is awareness of also? The staff should be aware of the reporting. We have a reporting system. Reporting of what? Reporting by doing OVR for trivial incident, for accident, for sentinel event, for near miss. You will be asking, what is sentinel event? What is near miss? What we should do? Root analysis. There are also adverse drug reaction has a special form. This also could be reported. And awareness of information reporting, the third that you should be aware that you should know that there is risk management. The risk management, if there is a risk, you should know, or there is management of the risk. There are 3 words. We should identify the risk, we should analyze the risk, and we should control the risk. Whatever the risk is, we should identify the risk from where it's coming, analyzing the risk and its effect, and forming a solution, controlling, elimination, reduction, etc. So this is awareness, the first phase. Awareness will give information for measurements by reporting, measurements by indicators. Now I'm working in my area. I am doing good work or not because there is indicator. Indicator like a thermometer, which indicates the temperature. So the temperature means that I am sick or not, if I have high fever. So my work also should have indicator everywhere. Every department has its own indicator. For radiologists, they have indicator for safety. And for another areas, for the lab, they have certain indicators. In general, there is the indicator for mortality of the hospital. How many patients die in the hospital every month, every year. These are indicators which can help for quality, to control quality. Also statistics by these indicators, by this OVR. So we do statistics. How many patients died? Mortality increasing 50%, now to 60%, 70% increasing or decreasing. And if we have a problem or a project or to improve, we will have a methodology. So measurements should, in the methodology that there is methodology which means PDCA. Everybody knows this. Planning, doing, checking, and applying your system, your idea.
So in measurements we have also 3. Like in awareness we have 3. In measurements we have 3. And after that there is improvement. We give from the measurements to improvement. The PIP, the PI department, PI improvement, performance improvement, will evaluate the results, will monitor the BDCA if it is sufficient, satisfied, or to be repeated, and they give recommendation. That's what we should know about quality. Now, we have the first question. What is the abbreviation of infection control? Can you answer me? Infection control. Abbreviation.
HYS.
Bravo! What is the abbreviation of rights of patient?
ICCPCC.
Excellent! What is the abbreviation of environment of care? Size. Bravo! Thank you very much. By this way, please keep this in your mind, this information in your mind. I will give you also a copy in video to see this lecture. You can see it 3 times a day after food, and the next week twice a day, and next week once every day, and you will never forget it. Thank you very much.